Okay, well, good afternoon, everyone. My name is Cyril Shukla. I'm an outreach coordinator for Crossroads for Hope. We were formerly known as Cancer Support Community Central New Jersey. We're happy to welcome you back to the Cancer Disparities and Experiences of the LGBTQ plus community series. Today's topic is understanding and providing cultural competent care for LGBTQ plus patients. During today's presentation, we'll have a conversation on the history of how anti-LGBTQ plus stigma and discrimination has created barriers to healthcare and how organizations like RWJBarnabas Health are creating an LGBTQ plus affirming environment. Our presenter today is Alicia Rogers. She's an advanced practice nurse, BC, I don't know what that stands for, from BAPS, Siperstein Proud Family Health at Robert Johnson University Hospital-Somerset. And Alicia, the floor is yours.
Hello, everyone. Good afternoon. Again, my name is Alicia Rogers. I'm a board certified advanced practice nurse, and I work at the BAPS Siperstein Proud Family Center. My pronouns are she and her. And so we're going to get started, and we'll start off with a presentation, a pre-poll presentation. Let me see what you know, and then we'll figure out at the end if I taught you everything you need to know. So here's your pre-poll presentation.
Okay. I'm going to end the polling, and I'm going to share the results for you to see the responses. And then we'll do the post-presentation poll where we will sort of reveal the answers. So we have 89% true for the first one, 100% true for the second, and 100% true for the third.
Perfect. Okay, let's get started with the presentation. So the LGBTQIA community has a long history of stigma and discrimination that causes barriers in access to healthcare. We know that these barriers are directly linked to inequitable healthcare outcomes. So what Robert Wood Johnson has done is established a place that is inclusive, welcoming, that can help eliminate some of those healthcare disparities. It's very important to know that the LGBTQIA healthcare journey is a long journey. It's not something to do overnight, that you learn about overnight. I've been at BAPS Siperstein Proud Center for about a year and a half now, and I learned something new every day about the community, learn something new about how I approach healthcare every day, depending on the individual. Next slide. So when we talk about all of the alphabets, the LGBTQIA, what are we really talking about? So this group is encompassing of a lot of people. So this just breaks down the categories. Lesbian, gay, bisexual, transgender, transsexual, which is a really outdated term, but we do still have older individuals who do identify as transsexual. Queer, which was once a derogatory term that has been revamped and re-owned by the community. Questioning, intersex, ally, asexual, and pansexual. So when we talk about the QIA+, we're including anything that might not be on this list as well. Next. What does being transgender or gender non-conforming really mean? The experience of a person assigned sex is not aligned with their gender identity. So for trans males who are assigned female at birth, they identify as male. For trans females who are assigned male at birth, they identify as female. Non-binary individuals do not identify as their sex assigned at birth, but they don't feel comfortable with the binary male or female gender as well. So a lot of times their pronouns are they and them. When we talk about gender dysphoria, it's really the discomfort and distress one feels surrounding that your gender identity is not aligned with their sex at birth. Back one. So what are some triggers for gender identity? Okay, so ding, 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 this is one of the poll questions. Some of the triggers can be physical features. I have patients who tell me that mirrors cause them dysphoria. Being misgendered, having people not call you by your preferred name once you have identified and told them what your preferred name and pronouns are. Bathroom use is a huge cause of gender dysphoria, especially public bathroom uses. Not feeling comfortable going in the bathroom where people assume you should go into, but knowing that you should be able to go into the bathroom that you feel most comfortable going into. Systematic and institutional biases is also a huge trigger of gender dysphoria. So who are these patients? About 4.5% overall of the US population identify as LGBTQIA+. Gender, this puts them in a category of a minority, but also their racial identity can also combat them being marginalized, especially in the healthcare industry. Geographically, they are throughout the country, and identity versus behavior is a big thing. I think it's important for us not to assume that sexual identity and gender identity are two things, one and the same. It's very important to separate how we assume someone should behave because they now have identified as a trans male or trans female, because it's all individualized. Next slide. So what are some healthcare avoidance behaviors that happened so that the community does not feel comfortable coming to certain facilities? Previous experience with healthcare systems such as violence, discrimination, sign-in sheets that don't allow for you to put your preferred pronouns or your preferred name, fear of coming out to the provider, sensing biases from the provider when things are mentioned, or talking about news and giving their personal opinions. That's a big issue as well. Gendered healthcare, I see trans men for GYN care, and as we talked about before, that mirrors and body parts can cause them dysphoria. So it's very important that I take the precautions prior to doing anything gynecological with them, making sure they feel comfortable, giving them additional sheets to cover them, additional gowns to cover them, and making sure that even if I have a chaperone in the room, the chaperone stays at the head of the bed, not at the bottom of the table, the exam table. Lack of access to competent healthcare. This is very important. Being able to go to your healthcare provider, whether they're your primary care provider, your GYN provider, and being able to talk to them about being on HRT, and them feeling comfortable enough to give you realistic outcomes and not biases, their own personal biases. And again, negative healthcare outcomes associated with healthcare avoidance behavior. The healthcare provider not taking care of the patient properly because they have their own personal biases. Next slide. So when we talk about the lesbian population, we do have a list of some healthcare disparities. 4 times increased risk of substance abuse, 20% higher rate of obesity, intimate partner violence for bisexual bisexual identified people, 61%, lesbians, 44% versus 35% for heterosexual women. Mental health concerns, stigma, discrimination, higher rates of suicide, who are not disclosed, higher rate for suicide for people who have not disclosed their sexual orientation or their sexual identity. Increased risk of breast cancer due to obesity and the fact that a lot of lesbian couples have not been pregnant, so that does increase the risk of breast cancer. Lower rates of cervical cancer screening for both male and female partners. Again, if I'm not comfortable disclosing my sexual identity or my gender identity to my provider, I'm going to avoid. So avoiding would be the direct correlation to those lower rates of screening. And again, the same issues with ovarian cancer. Next slide, please. So for our gay male populations, what are some of the health disparities linked to them? Parental abuse, bullying at school, and increased risk of homelessness in the youth. Increased risk of HIV, especially amongst minorities who are homeless and are in the sex work industry. It's important that we remove the stigma for sex work as well, because it's important to know that a lot of times sex work is the only way a lot of these individuals eat or find a place to sleep. And it's not always directly correlated with the drug use. The sex work usually comes before the drug use, and the drug use usually comes to cope with the sex work. Increased rates of anal cancer. And again, the same kind of mental health concerns that we've seen in the lesbian population. Increased risk of suicidal ideation, attempts, increased risk of substance abuse, and intimate partner violence. Next slide, please. It's kind of the same cycle again, even for our transgender community. The increased risk of substance abuse, 29% have reported illicit drug use versus 10% of the general population. Higher rates of alcohol use, binge drinking, higher rates of working in underground economies, whether it be sex work, drugs, selling drugs, and other things of that sort, especially for those in our Latinx, Middle Eastern, and Black community. Again, the higher risk for HIV infection, 1.4% versus 0.3%. Our transgender women are more likely, 2 times more likely to contract HIV. And 1 out of 5 transgender women of color have HIV, approximately 19%. Next slide. Asking only the information. So I think go back one for me, please. Okay, good. Okay, thank you. So when we talk about what can we do in healthcare environments to make the patients more comfortable, this is what culturally competent care really is talking about. So it's important to ask only the information that is appropriate to that visit. If you are not doing anything with their reproductive organs, taking inventory of their reproductive organs is not appropriate. If the care is not directly correlated to that, it's inappropriate care. Asking all the patients the same questions. You don't want to, it's the community is big, but it's very tight-knit. They use blogs a lot to discuss healthcare providers and stuff. So if you spoke to one transgender woman and you asked them this, but then you spoke to another transgender woman and your questioning was off topic, it's important to know that those kind of experiences are discussed. Providing just gender-specific care in a non-gender specific manner. So a great example of this is that I'm a women's health nurse practitioner, but I provide care for trans men. So I provide GYN care, not women's health care, which is a big, big difference and a big way of being inclusive to everybody. And applying screening guidelines to persons who are non-gender conforming. So it's also important that if pap smears are needed, that you make that a part of your care. If mammographies are needed, you make that a part of your care. If anal paps are needed, you make that a part of your care. You know, I offer the same care to everybody, specific to who they are, but I make sure that I'm inclusive with my care. Next slide. It's very important, and we talked about identity versus behavior, not to assume that because somebody identifies as gay or identifies as trans, that they are behaving in a certain way. I ask very specific questions about sexual history. Have you ever been sexually active? You know, and what is the gender identity of the person you are sexually active with, and what was their gender assigned at birth? So it's very important to understand both. And is anything that you're doing putting you at higher risk for any other things that I might need to evaluate you for? Asking uncomfortable questions in a very comfortable manner is reassuring to the patients. So I enter the door with, you know, introducing myself, welcoming them, and telling them how I know that this is a big deal for them to come to this appointment today, and that we're grateful that they're there. So I put the onus on us that we're happy that you came today. Next slide, please. Creating a affirming environment is important. We also provide training for employees upon hire that can get them comfortable with knowing that the Siperstein Proud Center is a part of this organization, and that we are definitely wanting to encourage them to learn more and to find out more about what we do and how we do it. Last June, we opened the door to the clinic for people who've never been in the office, you know, putting up information about Pride and about the LGBTQIA community, just to keep everybody abreast to what we're doing and why we're doing it. We do conduct ongoing education to the hospital staff. We also have gender neutral bathrooms in our facility, pamphlets and things that are indicative and relevant to the community are in our waiting room. And I am one of the providers that provide the services. We also have 2 other providers that provide this service to the community. Next slide. So we have got back to our post-poll. So if everyone was listening, the numbers should all be different. So let's see what we can do.
people are still voting, so I'll end it as we get closer to the number, and I'll share the results.
No problem. Perfect. Very, very good. So I thank you for spending your lunch with me. I hope that you took something away from the presentation. Come see us if you're local. We would love to show you around and show you what we're doing for the community. Thank you.
Good. This has been recorded, and I will share the link to everyone that was registered. And for any additional information, you have our websites on the slide. If you know of anyone that is impacted by cancer and is in need of any cancer support services, please feel free to reach out to us at crossroadsforhope.org. And thank you so much. Have a good afternoon.
Thank you.
Bye-bye.